There are different forms of surgery, and again, it depends on where it is or what kind of joint it is. But in general, what we want to do with surgery is get rid of all the synovium. And like I mentioned in the panel, we can never really get rid of all the synovium. So when patients say, well, don't I need my synovium? Well, sure, you need it, but you probably only need a small percentage of what's actually there. So really, our goal is to remove the diseased synovium. And for something like PVNS, the reason it was initially called PVNS, that stands for pigmented villonodular synovitis. And so pigmented comes from the blood. Like we mentioned, there's a lot of bleeding involved with this kind of disease. And blood products get taken away by the body and leave a deposition of hemosiderin behind. Hemosiderin contains iron, and so it gives a rust-colored look or brownish purplish discoloration. So fortunately, that's in a way useful for us because when we open a joint, we can see where the disease is because we just look for the purple. Orthopedic surgeons like to keep things simple, so you open a joint, just look for the purple. uh, so but the surgery it can be extensive because you want to take out all the diseased synovium. And each joint has particular techniques of how you can do that. But pretty much for every joint, the techniques are specialized and extensive. So you really need to have somebody who's familiar with doing an anterior and posterior operation in a knee, or doing a surgical dislocation of a hip, or doing a dislocation of a shoulder, or doing opening up an ankle joint to be able to see the whole thing. So these are all specialty kind of procedures that someone like an orthopedic oncologist may have been trained to do, but it's not necessarily something your average orthopedic surgeon is going to be comfortable doing.